Dear friends and colleagues, welcome back to the Mangano Digital Academy and welcome back to the Essentials of Digital Dentistry. In the previous lecture, I described the importance of combined computer tomography as a diagnostic tool because it completely changed the way we can see our patient in 3D and therefore our possibility to pose a proper diagnosis. In this lecture, instead, I will talk about combined computer tomography as a tool for the treatment plan, because we need to consider combined computer tomography also as a very important and valuable tool for doing things, changing treatment plans, using the very powerful tool of DICOM file and segmentation. As we know, digital dentistry is based on 4 different steps. And the first step is the scan, so the data acquisition, 3D data acquisition. We go from real to virtual, and we have combined computer tomography as one of the most important tools, as well as intraoral scanner, face scanner, digital condylography. Then all this information are re-elaborated in data elaboration software for the plan. We can make our plan, we can design our, for example, restoration, crown bridge in prosthodontics, surgical guide in surgery, in implant surgery, or even, orthodontic devices in ortho. Then we need to fabricate, we need to make these devices for the final clinical application through milling, through printing, laser sintering. Then we can use our, plannings, our devices clinically. And the combine is a game changer in this. In all of this, the combine is a game changer. Why it's a game changer? Because not only it deeply changes our way to pose diagnosis, but it also changes dramatically the way we treat our patient. Why? Why it's so important? It's so important because with the combined computer tomography, we can generate these DICOM files, and these DICOM files can then be imported inside our other softwares, for example, 3D reconstruction software, in the different field of dentistry. And through this 3D reconstruction software, then we can design a series of devices and implants. And I will show you the enormous possibilities of using combined computer tomography for treatment planning. This is quite important, and this is quite important particularly in the field of surgery, but not only in the field of surgery. Why? Because the use of DICOM file can change the way we treat our patients, and it can change it dramatically. We can really benefit from the machine. And in the previous lecture, I showed you how the possibility of using the different multiplanar reconstruction of CBCT allows us to visualize anatomical structures in 3D. So the risk, for example, of this extraction because the roots are very close to the inferior alveolar nerve. This is a very good diagnosis, and this has also an impact on the final treatment because the surgery will proceed accordingly, according to this risk, according to the anatomical consideration. But this is only partial. It's a possibility to use the CBCT as a diagnostic tool, but we can use the DICOM file also differently. We can use the DICOM file in order to change our treatments. And we can consider the difference between the volume rendering and the 3D reconstruction, because the visualization software of the CBCT usually they have also a 3D rendering motor, and they can reconstruct the images in 3D, and it's very nice because we can visualize the different structures in 3D. We can set a threshold and we can navigate also inside the different structures. But this is not a 3D reconstruction. The 3D reconstruction is different. The 3D reconstruction is a result of a segmentation. So we can differentiate between volume rendering and 3D reconstruction, because 3D reconstruction is something that we can mill, 3D reconstruction is something that we can print. 3D reconstruction is a model in which every single point has spatial coordinate that can be reproduced physically by a 3D printer, usually, for example, in maxillofacial surgery, in oral surgery, also with a milling unit, also with, of course, laser sintering and laser melting. It's totally different because we have visualization software useful for diagnosis, and we have reconstruction software used for segmentation. I started to use Mimics for Materialize long ago in university in the early 2000s, and it's a very powerful reconstruction software. Through this software we can perform segmentation, and from this segmentation, from the 3D model of bone, then we can do a lot of things, because we can design a lot of different, for example, custom-made implants, so we can design meshes for bone regeneration, custom-made scaffold for bone regeneration, even maxillofacial implants. I will show you in this short lecture the possible application, particularly in surgery, of the segmentation. But of course, the bone segmentation, that is a little bit more tricky, a little bit more difficult than the simple visualization of the 3D structure, is not the only way to use properly the DICOM file, because the DICOM file can be used by computer-assisted design software also for guided surgery, and it is the most important application to date for surgery. The implant surgery and the guided implantology is the most important application of DICOM file, I think, in the field of dentistry and dental surgery. So the COM-beam computed tomography can be considered a powerful tool for diagnosis, but also a very powerful tool for segmentation through the DICOM file, opening opportunities in computer-assisted design, computer-assisted manufacturing software for clinical application. And this is how it works with the treatment planning. For example, we can use DICOM file for guided surgery, we can use DICOM file for segmentation, for computer-assisted design, computer-assisted manufacturing application. Just a few examples. We can design over segmented bone, over 3D bone reconstruction, root analog implants, superiosteal implant, blade implants. We can design meshes for bone regeneration. We can design scaffold for bone regeneration. We can design personalized implant for maxillofacial purposes. Let's see how it works with some example. Guided implant surgery, fully in-office workflow, very easy. COM-beam computed tomography, visualization, pre-screening. Then we can export this DICOM file and we can put together this DICOM file with the different file, STL, standard tessellation language, polygon format, coming from the intraoral scanner. We merge this information inside a powerful software for guided surgery like SMOP, and then we can design our surgical guide with peculiar features, in this case an open frame guide, limited in dimension, good visibility, excellent stability. So after the merging, there's the design of the guide. After the design of the guide, there is the fabrication of the model by 3D printing with the NIX fab from DWS, and then the fabrication of the guide itself. We can check the stability of the guide on the model, removing some undercuts if too many undercuts are present, and adapting the stability as much as we can and we want, and then we use clinically the guide for the surgery. It's a conventional surgery through these open frame guides. We have published with Uli Oship this interesting report on our cases, very simple cases realized flapless, like one implant or single implant or multiple implant, through this system that is very reliable and no issues at all during the surgery. So it's a very helpful way to use DICOM file from COM-beam computed tomography. But it's not the only way, because COM-beam computed tomography, as I told you, is the door to segmentation of DICOM file, and it's the door to computer-assisted design, computer-assisted manufacturing application. Root analog implants are one example of this application. We performed these cases with Professor Figliuzzi long ago, and I have to admit that in my publication portfolio, this publication is one of the most cited of all, because probably it's a little bit creative, and being creative is always appreciated by our colleague. So the design of the study is very simple. We capture a CBCT scan, we import the DICOM into a 3D reconstruction software, we segment the bone, we segment the root, we make a virtual extraction of the root after segmentation, we add an integral abutment, designing it in Rhinoceros and in a reverse engineering software, and then we print, in this case we laser sinter or laser melt, the integral one-piece implant that can be placed without drilling the patient, because it's a perfect copy, it's a root analog, it's a perfect copy of the root that need to be extracted with the addition of the integral abutment for immediate loading purposes. And it is how it works. So double segmentation, segmentation of the bone, segmentation of the root before tooth extraction, before the extraction of the non-recoverable root. Then we add to the segmentation our integral abutment, and then the surgery performed by Professor Figliuzzi, extraction, very careful not to damage the wall of the socket, and then immediate placement of the implant that is a copy of the root that has been extracted, and immediate loading, of course, with a temporary crown, and the integration is very good with the tissues. And after 1 year, we can see the definitive restoration in place, and the picture is really fancy. I mean, it's something really fascinating if you watch, because we are used to see standard implant. This is a custom-made implant made exactly for the purposes of that patient, for that socket, to replace that root. And here the follow-up, as we can see, very stable bone level, no issues at all clinically after a long time, and very good integration from the perspective of, from the clinical perspective. So it's an option, it's possible through segmentation, it's a possibility to use DICOM-5 from combined computed tomography, but it's not all. We can also design our subperiosteal implants. This is a good application. For example, we have seen in elderly patients who already underwent some bone regeneration technique or therapies that failed. And these people, they don't want to undergo again to a long treatment like regenerative bone surgery to augment the bone volume. They only want to replace their teeth that have been lost. And in this case, we can design a subperiosteal implant custom-made in order to satisfy the request of the patient without spending too much time and money. And it's an interesting option. Once again, everything starts from a combined computed tomography, but the CBCT is not only a valuable tool for diagnosis. The DICOM are extracted, they are imported into a 3D reconstruction software, and then combined, of course, with the intraoral scan in order to create the virtual model of the patient. But the segmentation is the basis for everything, because the implant is designed exactly on the 3D reconstruction of the bone segmented from combined computed tomography. And then the integral abutments are added, the holes for the fixation screw with this peculiar design. These implants are called Juxta 3D, they come from BTK, an Italian company, sorry. And this is the aspect of the superiosteal implants. As we can see with the integral abutment, these implants are printed in titanium before to be delivered to the clinician for use in surgery. They are checked scrupulously and carefully on a 3D printed model of the bone, once again coming from a segmentation from combined computed tomography. And then the surgery that is quite fast. You need to open the flap, place the implant that fits perfectly, because almost perfectly, because it's designed exactly on that bone. And then you can perform also your immediate or anticipated loading with provisionalization. And after all, the results is not so bad after 1 year, and the patient is very satisfied, and everything has been done without any bone regeneration. So it's an option for the elderly patient and the patient who don't want to undergo complex surgical treatment, I mean like bone regeneration, because they don't want to wait too much and they don't want to spend too much money. But obviously for the patient who want to wait and who are willing to wait, they want to regenerate bone for the excellent also aesthetic and functional results, then we have this option. We have published it with Dr. Alessandro Cucchi, my friend, who is one of the most important experts in the world on this technique, surgical technique, this paper on a series of cases in which the vertical ridge augmentation was performed using computer-assisted design, computer-assisted manufacturing, customized titanium meshes for bone regeneration. So these meshes are membranes and titanium made custom on that defect for that patient in order to regenerate bone, and they work very well, as demonstrated by Cucchi and colleague in this article, at least from the clinical point of view. as we can see, with a very good level of vertical augmentation, bone stable, new bone, very little complications during the surgery, during healing, and excellent clinical result after all, with patients very satisfied. The solution is provided by the same company before, BTK, and everything comes from combined computed tomography, and then there's a segmentation of bone, and then there is a design of the mesh that need to contain the particle, the bone regeneration particle. Can be different kind of particle, synthetic or bovine. In this case, is less important. The most important thing is the performance of the mesh, and as we can see from these beautiful cases made by Dr. Cookie, the results were exceptional in different areas: posterior mandible, anterior mandible, posterior maxilla, anterior maxilla. A lot of new bone for the placement of the implants with these custom made meshes made in titanium for the bone regeneration. So for the patient who want to undergo bone regeneration, we have this option that is custom and come from the combined computed tomography. Once again, as we can see, a lot of beautiful cases made by Dr. Cookie, and very satisfactory results at the end from the clinical and from the point of view of the volume gained and the possibility to place the implant later without any problem and or complication. But we can also regenerate bone through custom-made hydroxyapatite scaffolds, synthetic scaffold in this case, as in these works made with Professor Giuseppe and Dr. Fabrizio Luongo. We published several papers with different applications in posterior maxilla, anterior maxilla, also in the mandible with Professor Figliuzzi, and I show you here one easy case with made by Professor Giuseppe Luongo and co-worker. Here there's a defect, bone that need to be regenerated, combined computed tomography, DICOM file imported in a 3D reconstruction software, design of the scaffold that fit exactly the bone defect of the patient. Then the scaffold is milled in synthetic hydroxyapatite using a milling unit, and it's ready for the clinical use and for the application. As we can see a few screenshots from the 3D reconstruction software, in which we can also design the custom-made scaffold. Here the adaptation of the scaffold in a reverse engineering with a hole created through the scaffold in order to have the possibility to fix for the fixation of the scaffold. Professor Aldo Macchi was one of the most important experts in this kind of treatment procedure. And here the scaffold is milled with a Roland DWX51. This product is called also 3D Bone from the same company before, BTK, and it's ready for clinical use. And here the surgery is faster with potentially less complication because it doesn't take so much time, and the results are very predictable, as we can see in this specific application, particularly when the scaffold is not too big. We can gain a lot of bone if everything is performed well and the soft tissue handling is perfect, no exposure, and then there is possibility after 6-8 months to place the implant. In this case the results is very satisfactory, as we can see. And also after a period of undisturbed healing, the implant can be loaded without any problem, and then we can put our crown, and the treatment has been very successful. So it's another option from CBCT. We can use DICOM file to design and fabricate custom-made scaffold for bone regeneration, and everything works quite well, as we can see radiographically. And I conclude with another option that is even bigger, the possibility to use CBCT file, CBCT data for making custom-made maxillofacial implants. This is a beautiful case made by Professor Francesco Grecchi, and it's very important to see how the digital tool can help also the maxillofacial surgeons in order to treat very challenging and difficult patients, difficult situations. This very tremendous destruction of bone because of cancer in this patient destroyed basically the whole body of the mandible. There was a need of reconstruction. Several conventional therapies failed, and so together with Professor Aldo Macchi, Professor Grecchi, and Professor Carlo Mangano, they decided to rehabilitate this patient with a custom-made implant in titanium that had to replace the whole mandible. So the cone beam computed tomography was segmented, the bone was segmented, and then the design was performed. The design of the implant was performed. The implant was, fabricated by additive manufacturing, 3D printing, and then it was used clinically by Professor Grecchi in this challenging case, and it was very successful. This is the post-operative panoramic radiograph, and the results was really satisfactory considering the challenges of these cases, and it was possible also to load the integral abutment inside that were embedded in this implant. And 2 years, the post-operative pictures were quite satisfactory. The patient could bite again after a long period without this possibility, and the quality of life of this patient who already suffer from cancer really can improve very much using these implants. This is the cone beam computed tomography 2 years after the intervention, demonstrating a very good stability of the implant after this period of time, even if in a challenging patient. So the cone beam computed tomography is not only an extremely valuable tool for diagnosis in all dental fields, from endo to perio, surgery, orthodontics, since it opens the way to 3D and allows to see and evaluate the anatomy of our patient as it is, three-dimensionally, and so better. Cone beam computed tomography is much more. It's also a game changer for treatment planning. In fact, the DICOM file can be imported into computer-assisted design software for designing not only surgical guide, but also meshing and scaffold for bone regeneration and custom-made implants, in the latter cases using the powerful tool of segmentation. So thank you very much for your kind attention, and if you have some questions, please don't hesitate to contact me. This is my email. Thank you.